Please watch all the way to the end. Don't forget to like and subscribe. Please leave a question or comment at the end. We'd love to respond. Don't forget, please check out our website at www.mypfi.org. Hi, I'm Lennox Hoyte, MD, fellowship-trained urogynecologist, pelvic surgeon, specialist in female pelvic floor disorders. And the question today is, what is female pelvic floor dysfunction and how is it treated? So female pelvic floor dysfunction includes a set of symptoms, including urinary leakage, stool leakage, difficulty emptying the bladder, difficulty emptying the bowels, pelvic pain with intercourse. And this can be a set of distressing symptoms that can occur in up to 1 in 4 women over age 18. And the number can be as high as 1/3 of all women when you look at women coming to a primary care clinic. So it's pretty distressing. And the question becomes, how do you diagnose it and how do you treat it? So the diagnosis of pelvic floor dysfunction starts with a collection of symptoms, your complaint. I'm having trouble emptying my bladder. I'm leaking stool. I'm peeing on myself. I'm going to the bathroom all the time. I can't poop. It hurts when I have intercourse, for example. And what the next step would be is taking a thorough history by your practitioner, and that person can start out being your primary care doctor to rule out some of the more basic causes. If you have a UTI, for example, they can diagnose and treat that for you. If you get beyond the primary care doc and the symptom is still going on, you want to basically locate a fellowship-trained urogynecologist, specially trained urologist, pelvic floor physical therapist, sometimes even a colorectal surgeon may be of assistance. And then the next step would be a thorough history from a urogynecologic perspective, a physical examination targeting the pelvic floor muscles, tissues, and organs, and a diagnosis can ensue from all of those evaluations and tests. Once you get diagnosed with pelvic floor dysfunction, depending on the type, then an appropriate treatment plan can be arranged and made with you in mind and shared decision making, which is what we talk about in this day and age. You and your doctor can arrive at a treatment plan that's appropriate to treating your pelvic floor dysfunction. How's pelvic floor dysfunction treated? If it's straight pelvic floor muscle dysfunction, tightness, short, tight pelvic floor, active, painful trigger points in the pelvic floor, they can simply be treated by pelvic floor physical therapy, which can be very successful in treating certain kinds of pelvic floor dysfunction. It's non-invasive. It's a decent place to start a trial of pelvic floor physical therapy twice a week for up to 6 weeks, maybe even longer, can help go a long way towards curing certain kinds of pelvic floor disorders. So pelvic floor physical therapy usually is done awake, with the pelvic floor physical therapist working inside the pelvic floor tissues to manually release active trigger points in the pelvic floor. For many women, that can work quite well. Sometimes some women are what's called refractory to that technique. And so we offer here at the Pelvic Floor Institute a version of the physical therapy that's performed under anesthesia, which allows us to be able to be more vigorous in the manual release techniques. And we can use special anesthesia techniques, and we often can use Botox as well to augment the physical therapy while you're asleep for a much more effective, durable, long-lasting solution to your pelvic floor dysfunction if it's related to short, tight pelvic floor muscles or active trigger points in the pelvic floor. So that's certainly an option that's available here at the Pelvic Floor Institute. We perform that under anesthesia at one of our partner hospitals. Other treatments for pelvic floor dysfunction can include, based on evaluation, if it's urinary incontinence, we can determine the type and cause of the urinary incontinence. If it's not related to a pelvic muscle dysfunction, we can determine the cause and treat that appropriately. Similarly, for bowel disorders like fecal incontinence and constipation, we can also treat those as well. So we do see women from around the country and around the world related to refractory or difficult to treat cases of pelvic floor dysfunction. And we're happy to see you as well. Please visit our website, www.mypfi.org, or come see us here in Tampa Bay, and we'll be happy to evaluate you if you have a chronic condition of pelvic floor dysfunction and you haven't been able to have it treated successfully. We do see many patients with that kind of disorder, and often we can help those patients many times when others have not been able to. So please do come see us at the Pelvic Floor Institute here in Tampa Bay. I'm Lennox Hoyte. Thank you for watching. Female pelvic floor dysfunction is treated based on what the cause of the issue is. Sometimes there is a non-relaxing pelvic floor muscles, which can sometimes be treated with pelvic floor physical therapy. Sometimes there is a loss of tone of the pelvic floor muscles, which can sometimes be treated with also pelvic floor stimulation and physical therapy. But the treatment for pelvic floor dysfunction really depends on the specific type of pelvic floor dysfunction, what the consequences is to the bowel, to the bladder, to sexual function, and treating it based on what that diagnosis is. Don't forget to like and subscribe. Please leave a comment or question. We'd love to respond. Don't forget, check out our website at www.mypfi.org. Thank you for listening.